Before we visited Community Health Network here, we have a pretty sophisticated system where we do an analysis of the needs of rehabilitation services based on the patient flow from med-surg hospitals in the local community. So we knew that Hook Rehabilitation had a fantastic reputation in this market, but because of the physical location and the limitations of the physical location within the walls of med-surg hospital, we knew that there was well, first of all, we knew there was a larger demand for patient flow. And so when we came to visit, we knew that we could justify building a large freestanding rehabilitation hospital. And really, so that the need was there. But the first time we met with the senior management team, it was just a fantastic fit. And the reason it was a fantastic fit was the quality of the senior management team. And the senior management team of Community Health Network's focus on patient first, superior patient outcomes, and their culture fits so well with Centerre's. We're in the business to treat patients to have superior patient satisfaction, family satisfaction, physician satisfaction, and superior clinical outcomes. And to maintain a superior relationship in the partnership where we work jointly in delivering the rehabilitation services in this community. The senior management team at Community Health is by far one of the best that I've ever dealt with. And I've worked in some large med-surg hospitals, and their focus on patient first is incredible. And that just fits so well. First thing when we have a patient family come visit us is we want them to really focus on why would their family member be admitted to a rehabilitation hospital, and what do you want the end result to be, and how does this entity measure the clinical progress and the clinical outcomes and report those clinical outcomes, and what database do they compare that to. I mean, the reason you're in a healthcare facility is to get well. And so that would be the first thing, and that is the first thing we focus on is our clinical outcomes. And we share those with patients. And our return home, our low acute care transfers, and the clinical progress, what we call the length of stay efficiency that a patient makes while they're in our facilities. We compare those to national averages, and we're well above the national averages in all clinical benchmarks. And so but you've got to, I mean, when you're admitted to a hospital, so much is related to a healthy, upbeat environment. And our facilities are pristine. They're gorgeous facilities. Our staff are focused on the patient and the family needs, and the physicians are focused on the family and patient needs. And those things are taken for granted so many times. And the engine in our rehabilitation hospitals is superior patient outcomes, superior family satisfaction, and superior patient satisfaction, and a happy, upbeat staff that have a passion for what they do when they come to work every day. The driving force was first, we looked nationally. First of all, we had the expertise with our team. We had the clinical expertise and the administrative expertise. The four senior individuals that started this company have over 100 years experience in the rehabilitation arena. First of all, we all have a passion for rehab because we see the patient return home, return to work. It's just such a great environment to work in. But we've got a national database, and we did an assessment nationally, and there's a need for rehabilitative services with the aging population, with healthcare reform. The post-acute services are vital to that process, and they become more important as we move more into the healthcare reform. And the rehabilitation hospital is licensed under the same manual as our partner hospital, med-surg hospital. So the level of services that we provide, the variety is definitely not like it is in a med-surg hospital, but the clinical integrity and the guidelines and the quality indicators and how we manage is basically the same as it is in our partner hospital. So it's a delivery, rehabilitation services is a delivery mechanism where you've got the standards for quality, you measure those standards, and you report those standards. And because of the aging population and our partner hospitals' limitations with units in the walls of their hospital, there's just such a need for more modern equipment, more space, more family friendly environment to, where they can park and just come right into the rehab hospital. It's just one example. But specialized programs where we can dedicate a PT gentleman to a brain injury population, and our clinical staff, they're focused, and the volume and flow of patients is of a level that we can intensify those services. So we as a company, we have protocols for the physical plant and the physical layout, but we never take things for granted. We always pull the physicians and the clinical staff in to review our plans. And it's like anything, if you continually monitor and just don't take for granted that you're perfect, and you bring individuals that have a different brain set and a different knowledge base, and in each community we go into, that's a little different. So we have our clinical staff looking at our standard protocols for these buildings, and in every case, and particularly here, we were able to enhance the protocols. The brain injury unit, the intensity of services and the level of services and the space that we've provided for the neurological programming is larger in this building. The outside garden, there were modifications to accommodate more of a neurological mix. But the one thing consistent is we understand that we're going to be treating sicker patients. And that is our model. So we make sure that we accommodate the needs of an internal medicine doc or a hospitalist when they are working in the facility. We expanded our pharmacy services in this building. But all of that comes from just not taking for granted that you've got the perfect model. We're pretty close to perfect, we think. But we always tweak it, and we want the input in the local community from the clinical that treat patients in that local community. I've worked in large med-surg hospitals, and when I first became the CEO of a freestanding rehabilitation hospital and didn't have to deal with a lot of other services like skilled nursing, home health, the foundation, and I was in an individual rehab hospital, I created some programs, and one of them was walk in my shoes. And I would walk in the shoes of some of the staff. I would do the job that they do. And I would go up to the floors, and I'll never forget, when I initiated this program, I worked in the brain injury unit. And so I had the opportunity to attend an initial eval of a patient that was admitted to the hospital. And I did this for several weeks. So I came back at the end of the week, the beginning of the next week, for a second team conference. And then I was there for the third team conference, and I saw the progress that the patient made. And I saw the work of the clinical interdisciplinary team working with that patient, and the unity and the passion and the focus that all these clinical staff have on one patient at that time. And there's a plan of care developed that is implemented during that week, and then it's reassessed at the end of 7 days. And what progress are we making? How do we have to tweak that clinical plan? And that just gave me a passion more than I had before. You see the patient, the progress the patient makes, and the progress the patient can make to go back home and to live a life and to live with their family again. And that's what this business is all about. And that's what we focus on. And that just is in my heart today. I think about that a number of times. What is the true value, and why are we in this business? And that's it. That's it.